45 seconds for some time now. Good evening. Thank you for coming. My name is David Smitherman. I'm the county manager of Onslow County, and tonight's an important first step in the long ordeal that has been the opioid lawsuits and subsequent settlement in North Carolina. So tonight we are here to learn about this program, to understand how these opioid settlement funds can be used and how best we should use these in the community to battle the opioid crisis. So this, as you probably know, this crisis came about over the last decade or more as pharmaceutical companies used marketing to push opioid products into our society, into our medical system. These are highly addictive medications, of which have been traditionally prescribed for quite a significant number of purposes, and which unfortunately led to a good number of deaths, as well as some impacts to what we do, what others do in the community to keep us safe and to advance our quality of life. North Carolina joined the lawsuit, as well as many other states representing local governments that were impacted by this pharmaceutical industry. In 2021, there was a settlement, and about $1.3 billion was awarded to North Carolina. The state has chosen to distribute these funds based upon a formula that was developed on the national level, and Onslow County expects to receive about $19 million. Now, that $19 million will be distributed over 18 years. So it's not a one-time infusion. It's going to be an ongoing program that we administer in this community for the foreseeable future. The payments have begun and will continue until the year 2039. Oh, I skipped ahead. Oh, man, I'm so sorry. Oh, thank you, Kevin. So what we want to do, what the endeavor of the county is to make these funds available for effective purposes. And that effectiveness of those purposes will be determined in an objective way by the county. We want to make sure that we don't duplicate efforts in our community and that our money is going to programs that are effective and can prove their effectiveness over time. So it's important this evening that you understand how we have been affected by the opioid epidemic. And with us this evening are quite a few professionals whose service areas have been the most affected by our opioid crisis. First to present this evening is going to be Sheriff Chris Thomas, who's going to tell you about how the law enforcement community has been impacted by the opioid epidemic. Sheriff?
Which one of these moves forward? Good evening, everybody. First, thank you for being here tonight and showing interest in what we're trying to put on and trying to share with y'all tonight. The opioid crisis in Onslow County and the United States, for that matter, has been driven, as he said, by the original medications pushed by the pharmaceutical industry, which is where obviously this settlement comes from. But it had a side effect. North Carolina passed some laws to limit the prescription of those medications a few years back. However, the problem had already started, so folks started seeking other avenues to get an opioid or an opioid derivative or synthetic opioids so they could continue their addiction or feed their addiction, actually. In between January of this year to October this year, we've had 277 overdoses that the sheriff's office has responded to. I'm sure EMS has responded to some that we have not. We have deployed Narcan 168 times. We have done over 1,689 involuntary commitment transports, and that is traveling over 196,511 miles. To give you an explanation of what an IVC is, it's an involuntary commitment, usually for mental health or substance abuse. A lot of folks who have mental health issues, they try to treat those issues by using some type of substance, and I'm sure a lot of you are aware of that, which exacerbates the problem. When a family member or a doctor or someone comes and gets an involuntary commitment on somebody trying to get them into treatment, trying to help them, by statute, the sheriff's office is responsible for their transportation. In other words, we pick them up at their homes or wherever they may be. We transport them to a local facility to get them evaluated. It may be Dick's Crisis, it may be at OMH Hospital. If they need placing in a facility for treatment, then we have to pick them up and we transport them to that facility. The facility can be anywhere in North Carolina. We've transported individuals as far as Asheville. We've transported, so we go to Holly Hills, we go to Raleigh, we go all over North Carolina transporting folks. That's a large burden on us, which you can tell by the number of transports we've had. We've had as many as 12 in one weekend. So it can be a tremendous amount. But to add to that, if an individual is transported under IVC and they're treated for 1, 2, 3, 4 days a week, and they're being released, guess who's responsible for going to pick them up? The sheriff's office. If a family member can't go get them, then I have to send a deputy back and pick them up and bring them back home. So that is an added burden that we have, which is directly related to the opioid crisis. We've done a few programs or several programs with the sheriff's office. One, we started deploying Narcan a few years back when it first came out. It was billed as a helping agent for people who are overdosing. I will say folks who are overdosing on fentanyl, it does not always work. It does not always work. It's about how quick you get there, how much you have to administer to them. But in addition to that, we have a federally funded program which we started this year. It's called a Medical Assistance Treatment Program. It is in our detention center. It's a grant program. It is federal money that we're using to run this program. When we originally wrote the program, we wrote it for pregnant females that are brought into custody. When individuals are brought into our detention center, they detox. They're coming off the drugs, whatever it may be, and it can propose a lot of health issues. It can propose dangers or create dangers for an unborn child. So this program, if we can put them on this treatment program, it alleviates a lot of those problems. It prevents us from having to transport them to the hospital. If I transport an inmate to the hospital, I've got to have a deputy or detention officer sit with them there, so I can't just leave them there. So this allows us to do it within our facility. But in the same breath, we've expanded it or are expanding it to anybody who comes in with an addiction that might be suitable for this program. We have a correctional case manager, which is a part of this grant. She is also a counselor. She helps get people in contact with services when they get out, helps go into rehab. She helps map out a program for them when they get out so they have a chance of taking a different avenue and not being addicted, which in turn saves all of us money, time, and may save their life. It keeps them from going back to our detention center. In looking at some of the stats over the years, if a friend of mine said this, if you could equate crime as an engine, then addiction is the fuel. The majority of your breaking and enters, the majority of your larcenies are all folks generally trying to get money so they can buy a controlled substance to feed their addiction, which also causes a revolving door for us. I know a lot of you see we have car breaking and enters in our county. The majority of them are that. They're seeking something where they can get some money so they can buy controlled substances. As you see the numbers, we have 13 people that's received a match so far up until November 1st. We have 2 recipients that remain in the center right now. We are expanding that program. We have to work with our medical provider to do it, obviously, because it's a medically assisted program, but it is federally funded money. With that said, I'm going to turn this over to Onslow County Emergency Services, Norm Bryson, and he'll talk about the settlement in the community.
Thank you, Sheriff. Good evening, everyone. In 2018-19, Onslow County started receiving grant funding from a couple different sources to start a new program under our EMS system. That program was called Community Paramedics. And the reason we brought this group on is because we saw a rising increase in several things. One, in drug addictions and how it affects people. The second side is mental health. A third piece is also to help with homelessness. And then the fourth one is with the elderly that don't have family members in the area to help take care of them. We saw these 4 areas causing a large increase into our overall call volume for EMS. And we brought upon this team to try to be able to help bring down those decreases. Now, they have led a large battle for us in working towards trying to help people to get off of opioids or any forms of drugs out there. I actually have a good portion of my team who's here with me tonight. If I could actually ask them to stand up in the back of the room, please. This is some of my team of my community paramedics and our peer support staff that we have with us. And gang, I thank y'all for being here tonight, and I also thank y'all for setting up the table out front that has information and stuff out there for us. But as we look into what we're dealing with, community paramedics, which are paramedic level trained people who are out there trying to help diagnosing and helping the staff. Then we have our peer support personnel. Peer support are people who have had addictions or problems before that are being that peer or support to people who have those addictions, trying to help them, to coax them, to get them off, working with them on a regular basis. We also have 4 chaplains that work within our group as well. Not only do those 4 chaplains help with the mental health and addiction purposes, we also use them to go out on many other calls, related deaths, being able to help with the families, even also to bring some closure with people during structure fires. So we're very proud of this group of people that we have for what they do for us. When we start talking a little bit more about what we do and what we're looking at, from January 2023 through October 2023, we have 519 overdoses that we've responded to, and 350 opioid of those, or 350 are opioid overdoses. This is an average of 3 overdoses with resuscitation before finally accepting services for Onslow County. Part of what we're trying to do through this program is to get to people after we've gone through a resuscitation or they've had an overdose, to work to get them in through programs. They are a great bridge trying to get people to the point that they can actually seek help. Other things that they do is go out and with their training, stakeholders, community group trainings. We've had 62 training events that have been provided. 890 participants have been part of that training. And Narcan administered for opioid overdoses is 382 times before EMS has arrived. That is Narcan out in the public that is being administered by a non-medical provider ahead of EMS getting there. And that part of those that Narcans are coming through the program that we have through some of our grant systems that we've been using. We'll also be using part of the Opioid Settlement Funds to get more Narcan on hand so we can try to get more out into the communities. Next, I will turn this over to Chrissy Richmond Hoover, who is our health director, to talk a little bit more about it.
Good evening. At the Public Health Department, we're very interested in what causes illness and death in the community. And what I want to draw your attention to tonight is that if opioid overdoses were a standalone category for causes of death, it would be a top 10 leading cause of death in Onslow County. What you'll see in this graph is that the state, which is the green line represented, plateaued somewhat from 2021 to 2022. Onslow County is represented by the blue line. The Onslow County trend continues to rise. What we're looking at here is the death rate. This normalizes these statistics for the population size. If you look at the bottom of the graph, by the year, you'll see N equals. That N equals gives you the actual number of deaths that occurred in Onslow County each of those years, and you see that that grows year over year. When we get to 2022 and we see that there are 79 deaths, all things equal, that would put it as about 4th or 5th as a leading cause of death in Onslow County. Next, we take a look at who is this primarily impacting? And over half of those overdose deaths are white males. Most of them are young. They're between the ages of 26 and 35. 61% of those deaths occur in the individual's home. Largely, this is a group that is single. They are unmarried or divorced. They don't have high educational attainment. Over half of them, the highest education that was attained is a high school diploma or a GED. And then lastly, most of these deaths are occurring with more than one drug. The top drugs that we see are fentanyl and methamphetamine, and the majority of these overdoses, is probably not surprising, occur on Saturdays when people have free time. That's just a brief snapshot into what we're seeing in our community and to help show the magnitude of the problem that we have in Onslow County with opioid use. Ms. Sanders Veronica will now give us more information about the settlement funds.
Good evening. I want to apologize for my voice. I was at a football game this weekend and I cheered too loudly, so I will try to speak loud. So my name is Veronica Ortiz and I am the Behavioral Health Program Manager. Part of my job is to manage the Opioid Settlement Funds. As you heard from our county departments, the opioid use has greatly impacted our county. Every day, county resources are used to fight this epidemic. Opioid funds will assist our county not only in responding to the growing needs associated with opioid use, but the long-term effects that it has had on our community. Opioid settlement funds are a great resource, and to ensure transparency and that we remain true to the purpose of these funds, the state requires that all opioid funds be used to support programs or services that serve persons struggling with opioid use or co-occurring mental health disorders. Another thing that the state has put in place is to help counties make the best use of these funds. The state developed 12 concrete strategies to advance prevention, reduce harm, and connect people to the services that they need. The strategies are as follows: collaborative strategic planning, evidence-based addiction treatment, recovery support services, recovery housing support, employment-related services, early intervention, naloxone distribution, post-overdose response, syringe service programs, criminal justice diversion programs, addiction treatment for incarcerated persons, or reentry programs. So everything that we do with these funds must fall within one of those 12 categories. And I know that they're not listed up there, but they will be listed on our website for anybody who would like more information, a more detailed description of these strategies that will be available to you. We will have a QR code. So now that we have these funds, what do we do with them, and how did we determine what we're going to do with them? That's a good question if you were thinking it. While $19 million is a lot of money, I would like to remind you that that is not readily available to us. That is money that is going to be issued or paid out to us over the course of 18 years. So we have to be very careful in how we spend it. Onslow County Government recognized that in order to ensure that services were not duplicated, we needed to collaborate with our community stakeholders. So a task force was created in 2022. This task force was comprised of Onslow County Government, Social Services, Public Health, Onslow County Schools, the Sheriff's Office, Jacksonville Police Department, Onslow Memorial Hospital, Trillium, mental health professionals, the City of Jacksonville, Marine Corps Community Services, local nonprofit agencies, faith-based organizations, veteran service organizations, and most importantly, people with lived experience. This task force provided very valuable input, reviewed the relevant data in regards to opioid use in our community. They identified the gaps in the existing service continuum of care, and they participated in a rank order vote, which identified the top 5 strategies that opioid settlement funds should be used for the funding of services, and based on that, a report called the 2022 Opioid Settlement Funds report was presented to our commissioners. This full report will also be available on our website. It'll give you an explanation of the process that was taken to determine all of the resources that currently exist in the community, and again, the gaps in services, and what our community needs, or the strengths and needs of our community. The Opioid Settlement Funds Task Force continues to meet on a quarterly basis. They continue to provide input. They review data. We last met in October. We'll be meeting again in January. And their input is very valuable. We appreciate their collaboration and helping the county help us guide the use of these funds. We recognize that we cannot make decisions alone, and we have to do this as a community, and so this task force has been very instrumental in helping us do so. Ms. Carrie Sanders will come up next and provide you information on how these funds are currently being used.
Good evening. I'm Carrie Sanders, one of the assistant county managers. As you heard Ms. Ortiz talk about the 12 strategies that were determined by the state, and that all of our interventions and programs must fit under those strategies. So one of the goals of our task force really was to ensure that we were addressing the biggest needs within the community, or at least starting at that point, and that we wanted to have the greatest impact on our community. For fiscal year 23-24, the Opioid Settlement Funds are currently funding the following services. Under the Collaborative Strategic Planning Strategy, the county hired a behavioral health program manager to manage the opioid settlement funds. This position is responsible for facilitating our task force, ensuring that we are in compliance with all of the state requirements, that we are doing our reporting requirements, and any contracts that are managed through the opioid settlement funds. This position also does community outreach, and Ms. Ortiz currently holds that position. She's been in her position just under 7 months, and she hit the ground running for the county. She had to do a lot of work to get up to date and learn just about opioid settlements. The state is coming out with new requirements and different things that we're required to do. So she really has had a huge impact on ensuring the county is following all the guidelines with the opioid funds. The second strategy that we are currently focused on is recovery support services. And this is where the county entered into a contract with the Healing Place in Wilmington, North Carolina. This allows for 10 beds on a monthly basis for adult men and women from Onslow County. So this allows our citizens with opioid use disorders to be admitted for detox, have continuation of medicated assisted treatment, and also long-term recovery beds. From February of 2023 through November of 2023, 82 Onslow County citizens have been able to access beds at the Healing Place. This equates to over 1,300 bed days that were paid for through opioid settlement funds for our citizens. The third strategy that we are focusing on is post-overdose response. You heard earlier from Mr. Bryson about the tremendous impact our community paramedics are having with the individuals in our community. The community paramedics are connecting persons who have experienced a drug overdose with treatment, recovery supports, harm reduction, and anything else that is needed to improve their health and well-being. And then the fourth strategy that we're focusing on is reentry programs. Again, you heard Sheriff Thomas talk about the licensed clinical addiction specialist that is housed within the detention center. And she's providing those services, treatment services, also recovery support, harm reduction, and any services to improve the health and well-being. She also is able to follow up with inmates that have been released to ensure that they are connected with community supports and following through with the resources within our community. One of the other strategies that the task force has identified from the very beginning was the need for prevention services within our community. For fiscal year 24-25, which we're currently working on, prevention is a top priority. We are currently researching to determine the best prevention programs and how we can best implement those programs within our community. Just a little bit about the requirements that the state has put on for these opioid funds. The requirements are very specific and very strict to ensure that counties are transparent in their spending and are meeting the goals associated with these funds. The local spending authorization is a report that lets our community know how we are using the opioid funds. Onslow County completed this requirement in the form of a resolution. The resolution details what strategies have been selected, what interventions are being funded, and the funding amount. The resolution for fiscal year 23-24 was reviewed and approved by our Board of Commissioners on August 7th, 2023. And again, that will be available on our website. The annual financial report is a report that's due at the end of February every year for the previous fiscal year. And we're required to report on the amount of opioid settlement funds we've received and spent throughout that fiscal year. To date, Onslow County has received a little over $1.3 million. These funds are a huge responsibility, and we take this responsibility very seriously. We are being deliberate. We are ensuring that we are doing our research and being strategic in our planning for the use of these funds. As I said earlier, we truly want to address the biggest needs that will have the greatest impact on our citizens and on our community. In fiscal year 22-23, we expended a little over $27,000. The funds were only available to us for about a 5-month period, and we immediately focused on getting our task force together, having those collaborative meetings, working on what the needs in our community were, what the gaps in services were, and identifying those priorities. So we were also able to execute the contract with the Healing Place in New Hanover County to ensure that we had treatment beds available. So that's where the majority of those funds went for fiscal year 22-23. And then the last, one of the other requirements is the annual impact report. And this is a report that we report on the impact of the programs that we have funded during the fiscal year, and it also includes progress reports and quality and outcome measurements. So we have now reached the point in our presentation that we would like to open it up for public input. We did ask citizens to sign up prior to the meeting. We ask that you use this time to give us input on what you feel the county should prioritize moving forward and what types of services you feel should be funded. This time is intended as an opportunity to gather input from you, our citizens, on the services. You will also have the opportunity when our website is currently live through onslowcountync.gov, and there is an email address on the website, and you will be able to also give us written input or comments if you would like. And although we don't really plan to respond to questions during this time, we will develop a frequently asked questions and answer document, and we will post that on our website as well. So with that, we are asking that you limit your comments to 3 minutes, and I will now call our first speaker who signed up for public comment, if Veronica would hand me that yellow sheet. And I'd ask that you'd come up to the microphone over by the flags. Michael Hudson.
Please forgive me, I'm not used to using one of these things very well. My name is Michael Hudson. I live in Sneads Ferry, which I understand is, at least at this point, still considered part of Onslow County. Having been a government worker in other states prior to moving to North Carolina, I've had the opportunity to see sometimes how data is dealt with. And one of the questions or concerns that would be very interesting to see on the website when this is all said and done is source material for where our numbers come from. In other words, when somebody goes to court and it's adjudicated, are we pulling directly from that data? Are we pulling from law enforcement data? Or, and sometimes there may be discrepancies between those. And how do we audit that information? How do we determine the true accuracy rather than just letting data be pervasive without scrutiny? Other things that I have personally dealt with is where there was a situation that did involve opioids, as far as I know, not from the pharmaceutical industry directly, but from illegal means that involved not only usage, but the buying and selling. And that information did not make it all the way through the system. And when I say that, all the way through the Sheriff's Department databases at the time. So I'd be very interested to learn more about that, especially since that's been my personal background. It's a situation that I would very much like to see how we determine the accuracy of information and early adoption. I mean, prevention is ideal. I mean, if we can prevent these things from happening, that's great. But the earlier we can get somebody into the system, instead of them having to be arrested 3, 4, 5 times, having to take them halfway across the state multiple times, ideally, the earlier we can get them into the system and get things corrected, the less expensive it is on the situation, and hopefully save more lives. Thank you.
Next, I'll call John Davis.
So do I get his 30 seconds? So, hey, John Davis, Mayor of Swansboro, and I got some friends back here. Thank y'all for what y'all do in Swansboro. I think 1 to 2 a month is what I understand that we have in Swansboro where Narcan has to be issued. For me, I've been on the recovery side primarily in support of an organization you may have heard of called Hope is Alive. It is relatively new to North Carolina, but that has been where I've been helping. I've been on the fundraising side. I've been fortunate to raise a little over $1 million working with them to get a home, a ladies' home in the Swansboro-Hubert area. And so that's where, and again, so as y'all hear me talking and kind of stumbling, because the more I'm involved in this, the more I realize I don't know. There's really a lot to this problem, and it's very expansive. But the area that I'm in is what I like to call the kind of the third stage recovery. It's where they're out of the medical situation, they are trying to get settled in life, and they just need that support. And what HIA does is basically takes them for 12 to 18 months, and it teaches them basic life skills and coping mechanisms and how to break away from codependencies and stuff like that in order for them to be successful, not just for 3 weeks or 3 months or 90 days, but the challenge that is put on them is to be successful for that 12 to 18 months. And if they fail, there's a discipline, and they're welcomed back after that discipline, and they try again. And the ones that do graduate, I believe there's like an 85% success rate or somewhere in there. So don't quote me on that. I might, again, I'm not the expert, but that's where I would ask for help because to my knowledge, we lack in Onslow County, really Carteret County, Crystal Coast, we lack beds for the long-term recovery. We don't have that. I'm only aware of the one home in Swansboro-Hubert. Maybe somebody could correct me if there's another home that does that long-term recovery. And I'm excited to see that it does support the faith-based organizations, because that's one thing that HIA does is faith-based only. And that's the only funds they will accept is funds that do not require them to go away from that. And again, they have a fairly good success rate. So that would be my encouragement for these funds. And certainly, I know y'all can't respond to questions, but I would like to see somebody off of HIA be on that task force, because I would like to see, and I've talked with the sheriff and others, I'd like to see us get another home in Onslow County, multiple homes if we can, and it's quite an expensive endeavor. So, all right, thank you.
Thank you. Next, I'll call Johnny Williams to the microphone.
Good evening to everyone. I'm very happy to see we're having a meeting like this. I want to address a few things, but I must admit I haven't had a chance to see this website that you're referring to, so some of the stuff I may say may be a little redundant. However, one of the biggest issues I've seen, and I've been in Onslow County a while, and I work with patients with substance issues almost 20 years from here in New York. And from my community perspective, the biggest complaint that I hear from some of the people that's been availed to some of these services, and not necessarily your services, but services in general, is they don't have a comfort level, because a lot of the people that they're working with don't seem to have the compassion, at least that's the way they perceive it, that they're used to. Now, we all know that people with addictions are very sensitive anyway, but I'm just saying, I think with some of this funding, maybe we can figure out a way to make things a little more availed to address issues like that. Because if a service is there and you're not using it, it doesn't really help you. Of course, if you OD, you take help from anywhere you get it. But in general, I'm saying I just think with the fund, I don't know if it's one of those 12 strategies or not, but there need to be, in my opinion, some mechanism where you can make the patient or the person feel a little more compassion is being given, and someone that's walked the walk that they've walked in their communities, in their lifestyles, and that type thing. And I got a lot more I want to say, but I'm going to review the website and see what I come up with. Thank you.
Thank you. Next, I'll call Marcia Wright.
Good evening. I appreciate the time to speak to you. I was very interested in some of the presentations that were made. I made a couple of notes to myself. The things I would comment on at this point is when I saw the article in the newspaper, the Jacksonville Daily News, that this was going on, I asked a number of people that I work with in various organizations and community-based programs and so forth, and no one seemed to know anything about anything that's happened since the announcement of the first settlement was made back in, it's almost 2 years by now. So between the settlement hearing and this evening, I hadn't personally heard any of the activities that were going on. So I would be concerned, and they were too, about is there any opportunity for community-based organizations, maybe faith-based, other programs that would be very interested in being a part of this and carrying on forward, who knew nothing about this activity for over the last almost 2 years. The next thing I would say would be, is there an opportunity for local groups who are not involved with the initial task force activity to get involved if they have some awareness of this, some expertise? There are a number of organizations in the community that have a long track record of successful community-based case management. And so they might be interested in seeing what they might be able to do. Is there an opportunity for local organizations who are not involved in the initial training to get training? I speak specifically about maybe church groups, fraternities, sororities, organizations that are almost totally community-based that would love to see some of this, have seen it, but need good training, because you don't want people out here spreading inaccurate information or anything of this nature. The last thing I would say is, I talked about how, you all talked about how the outcomes will be measured, and the gentleman I think was up before me was concerned about long-term treatment. People who have been homeless, domestic violence, all these kinds of issues take time to build. They don't happen from Monday to Tuesday. So when you have a person who has been in addiction for a long time and all the things that are going on around them, how are they tracked to see that once they leave that emergency, acute situation, what about the long-term tracking of a family? Over 18 years, is there something that you're building in to see how people are doing over the long haul, particularly women who have children? I've known of a lot of women who would have sought help if they had had a way to be able to stay with their children. And for most women, you're separated, foster care comes in, and they say, no, I'm not going to do this if I have to lose my children. And then you know what happens after that. So those are just some of the questions I had, and I appreciate your time. Thank you.
Melissa Oakley.
I definitely need more than 3 minutes as well, but I'll keep it short and use that email. I just want to say, first of all, thank you for accepting the SAMHSA grant that Ms. Vanessa Sapp is here tonight. She helped work on that back in 2021. That was given to us by the county commissioners. You guys accepted it so we could use Narcan in our schools just in case there's a student or a staff member or other adult that have an overdose crisis. My recommendation tonight will be two things. Childhood trauma education. So we have children in our county right now that their parents are overdosing, and they need education and support because they're the ones that are administering the Narcan, and then they have trauma from that. So just one of those things that I wanted to throw out there. And I'm going to be a little personal as well. There are some things that are not recognized in this county. There are some things that women face, like this young lady just said that was just up here. If you have a woman that's dealing with other factors like marital problems and things like that, and then you throw in something called PMDD. Our own hospital doesn't acknowledge PMDD, but it does have an ICD code. And that just actually got put on the record in 2019. Over 6 million women in this country have PMDD. It's premenstrual dysphoric disorder. And so pretty much 2 weeks out of the month before you have your period, you kind of have a PMS cycle on steroids, and that means that you face other symptoms that are mental health-like issues, and it's treated by SSRIs, which are antidepressants, or some women get birth control, and some have to take vitamin supplements. Well, I'm the woman that's the holistic approach girl, and also other anxiety meds. So whenever you have those issues arise, you can take that. Well, you have symptoms like suicidal ideations, issues with rejection, anger, mood swings. You might just be sad, you might be tired, you might not be able to sleep, you might be a variety of things. But if you don't know how to address those issues, if you have staff that can't recognize those issues, they're not able to help and give the proper support and education that's needed. We have a lot of women in this county that have PMDD as well, and I'm one of them, like I just said, but we have them in our schools. They teach our kids. They're afraid to ask for support because they don't want to be thrown away. So that's just my recommendation, and I'll be glad to sit down with anybody that's willing to listen, because this may change the game and the aspect as far as it comes with women and overdoses or over-medicating or whatever, and mental health crisis. So that's all I have to say. Thank you.
Thank you. I would like to offer for anyone else who would like to speak to come to the microphone, if we have anybody else. Go ahead. Come on.
Hello, my name is Lenisi Patton. I am the founder and executive director of Philippians Place. We work with people who are homeless. We work with people who are coming back from reentry and from prison. We've had a recovery home, and we have transitional home for those for coming from prison, as well as for those coming from recovery. I deal with a lot of the homeless issues. So the gaps that we see and the things that we need in Onslow County. So we need a detox center funding for transportation, which was already talked about, getting guys from here to the detox centers, as well as from there back. One of the issues that we have and that we have seen is that there aren't MOUs with the detox centers and long-term rehab programs that they're out there. So they're leaving Onslow County, going there. We know nothing. So we have to have MOUs and contacts with them because we're ready to catch them. But if we don't know when they're graduating and ready to come out, then I can't catch them. Our process is, we want to talk with that agency 3 months, 2 months ahead of time. Give me at least a month ahead of time, which we've partnered and done that, but that's something that needs to be done on the county level and the city level with these organizations like Dick's, with these other organizations. We have other organizations that we're partnering with that want to come to Onslow County and do detox here. I'd love to have detox here. They're ready to already partner with us and work with us. Larger shelter facility. 2 years ago, I could call the shelter and actually get somebody in that day. Now it's a week, 2 week, 3 week process, even though they have more beds. We need a day program because they have to be out of the shelter at 7 a.m. and they cannot go back until 6 p.m. We are currently running a day program. Not funded, but we're trying to help the people who are at the shelter. And so if we don't have that kind of program, they're turning to drugs. They're doing everything they shouldn't be doing. We also do transitional housing. I need more housing. I can catch the people, but I can't catch them if I don't have a home to put them in. Our stats with our program, they left us, when our clients left us, they were 80% housed. 6 months later, 80% housed. We are a faith-based program, transitional housing, but I need housing. And then I can actually service them. We have peer support specialists. We need funding for that peer support specialist, so we can I can transport them. If I get a van, I can transport them with my peer support specialists, who are the people who have actually come through my program and worked my program. So not only am I housing people and hiring people to do what needs to be done, but it's the people who's come through the program. Thank you for your time.
Thank you. Do I have anyone else?
Thank you for having us here this evening. My name is Greg Shanton. I've worked with Dr. Williams over 20 plus years and seen a lot of substance abuse, mental health issues. Seen it in my own family. I'm sure a lot of the people here can name 1 or 2 people in their family who suffered on this. But one thing that I get year after year after year is, Greg, I want to do better. I don't want to do this, but I got a record. No one can harm me. I got to take care of my family. We need to put some money into maybe having lawyers help some of these people get some expungements off the record. We need to have the county start hiring some of these people to work jobs. Give them that first step. Let them get credit history so they can get a good apartment and all that. But if we just keep putting a Band-Aid over it, after a while, the Band-Aid's not going to help. They're going to keep redoing the same thing. So once we get them out of rehab, let's continue. Don't drop the ball. Let's continue. Like the mayor of, I think Swansboro said, we need to continue this, not just for 3 or 5 days, not just for 2 or 3 months, but let's continue to support them. We support them, we're saving the next generation. Thank you.
Good evening. My name's Vanessa Sapp. I didn't plan on standing up tonight, but I lost my son in 2016 to an overdose. And since 2016, I've seen a lot of growth and stride from our county and a lot of support from our county. And I just wanted to thank you all for everything that you all do. Wonderful to hear that next year you're focusing on prevention. I do believe that from the years that I've been participating, prevention is absolutely the key. And whatever y'all need, I'd like to help research, whatever you need to help find more for our youth. I think areas, especially like Sneeze Ferry, where I live, children lack activities and things to do. We don't have a YMCA. We don't have much of anything out there. And I think that that needs to be a consideration. So thank you all for your time. Thank you for everything y'all have been doing. Appreciate it.
I'm going to turn it back over to Ms. Ortiz.
Thank you all for your input and your comments. So here it is. Here's the QR code for our website. Today is the launch of our website. And so on here you can go and you can read the strategies, you can read our opioid fund report, you can see our resolutions. There's links there for some resources. There's a lot more information that you can take your time in reviewing. If you have any questions, please feel free to email those to us at opioidsettlement@onslowcountync.gov. And so We want to thank everyone for being here tonight. We want to thank you for your interest. Please know that we are doing the best that we can to ensure that these funds are used wisely and that we get the greatest impact. And we very much care, and we want to do the very best that we can. So thank you for coming tonight.